The Public Servants Association has denounced what it calls shocking and dangerous conditions at the Koster Hospital in the Northwest Province. The association says ongoing non-compliance with occupational health and safety regulations is endangering employees and patients. Kabelo Moalosi, who's the Labour Relations Officer for the PSA in the Northwest, joins us for more. A very good evening to you. Thank you so much for your time. I mean, you've expressed your concerns about the dangerous conditions at the Koster Hospital. What are your findings?
Thank you, Mpo, for the invite and for giving us a time to air our dissatisfaction with the Department of Health. Thank you. As PSA, we have acknowledged that we have found that the Department of Health in Koster Hospital is non-compliant to OHS regulations. Among other things that we have found out at the hospital is that there are falling ceilings, there are worn out electrical wires, there is a leaking roof, all these things that poses danger to our patients and to also the working class.
So as you note some of these concerns, what impact is this having on patients and some of your members who have to be in this facility every single day?
Remember, in terms of OHS, it's a duty of an employer to provide and maintain a safe and working environment for all the employees. The problem is that when you don't provide such a safe and working environment, is that employees become dissatisfied. And in terms of providing services, and the service that they provide is not of a quality because of the conditions that they are working on. Mm-hmm. And we are saying now this affects patients accessing health care. So now this is a two-way street. Now these employees must provide services to patients and quality service, but the conditions that they must work on are bad conditions. So now the department must make sure that the conditions are hygienic and are also safe of any hazardous issues. Because remember, electric wires can include electric shock. Remember a nurse having to treat a patient in a condition where her safety is not guaranteed.
Yeah, absolutely. It sounds like parts of the hospital are unusable as a result of this.
Yes, and you ask yourself, why do we have to reach this stage where we have to go into national television for such basic issues? These are basic issues that the department should take care of. Because now, if there are rooms that cannot be utilized, they must be condoned off. And this also raises question in terms of the Department of Employment and Labor. Where are the inspectors? What job are they doing? Because such conditions, there should have been a provision notice on this hospital long time ago to make sure that there's alternative accommodation for all the patients. Because, you can imagine, Koster it's a little bit on an outskirt. For a patient from Koster to go to Rustenburg, it's around 70 km. Swartregens is also around 70 km, where there's the nearest hospital there. So you can imagine in the current conditions in South Africa, where somebody has got to drive such distance in order to access a better health care. So we say this condition cannot continue and should be corrected.
And with that call, how has the Northwest Health Department reacted?
We have engagement with the Department of Health, because now as labor movement we are part of a lot of committees inside the Department of Health that include OHS committee, safety representative, which are unions are part of that. So we are continuing to engage with the department on that. We are aware that the MEC is planning an urgent visit to the hospital, and we are awaiting confirmation from the department that indeed they will be there, and so that we can also be there.
So what would you like to see happen as that meeting takes place, and in terms of correcting and remedying the situation? Surely it would mean, from your description, that the hospital would need to be closed so that these renovations can take place.
We will not rush to say close the hospital, because remember, there are communities who are affected when the hospital has been closed. The first thing is that we need to make a proper assessment. A proper assessment meaning that we need to establish how many rooms are affected and how can we work around those rooms. And then after making an assessment that how many rooms are affected, how can we work around it. Now the next step that to follow is that we condone off the places that cannot be utilized. And after condoning of the place that cannot be prioritized. The CFO must be engaged to reprioritize budget in terms of PMFA so that there can be emergency procurement for alternative accommodation so that service delivery must not be hampered.
Yeah. Very well. Thank you so much, Kabelo Moalosi, Labour Relations Officer for the PSA in the Northwest, talking about those very serious concerns at the Koster Hospital in that province. For reaction, we're joined by spokesperson for the Northwest Health Department, Tebogo Lekgethwane. A very good evening to you. Thank you for your time. I mean, you've heard the concerns. The Public Servants Association is saying enough is enough. Something has to happen, and it has to happen fast because patients and healthcare workers' lives are at risk. How do you respond to this?
Yeah, well, thank you very much for the opportunity. Let me start by saying that Kabelo is right in saying that there has been engagements with the department. So it's a bit surprising also when it comes out now like he's not aware of what has been going on, because some of those engagements have revealed the plans of the department to deal with refurbishment. Their statement is saying we should not talk about the protests by the community that delayed the refurbishment to start, but that is key. And we had actually set aside 120 million to refurbish the Koster Hospital before those protests. And because the community wanted a new hospital, thinking that 120 million will be enough to build a new hospital. But we engaged the community and they were able to see that it's not possible for 120 million to build a hospital. That 120 million was just for the refurbishment. And because of those delays that were caused by those disruptions, we had to now use that money for other projects to avoid underspending. But also one issue
hold on. If you'll allow me to just interrupt you there. So what you're essentially telling me is that money was allocated and that money has since been used in other areas. So you're essentially back to the drawing board. How is that possible? Because you allocated money, the funds were not used, the changes have not been made. In fact, as you started, you said to me that you're surprised that the Public Servants Association is talking to us here live on television because engagements have taken place. Engagements don't mean that action has occurred. The situation hasn't changed.
Yeah, remember, when you don't use funds in the public funds, they are going to be returned to Treasury. While we have other projects that are waiting, that needs attention, we, of course, had to then replan for Koster Hospital. And eventually the community agreed that we can now proceed with the refurbishments, which is what we have planned. And all the stakeholders, in terms of the engagement that have taken place, they are aware that we have had the consultant. He's saying he's not aware of, he's still waiting for an assessment to be made. That assessment has already been made. And we know in terms of phase 1 of this refurbishment project, which areas are going to be implemented in terms of the refurbishment. Also, it is important to indicate that the Department of Labor has actually already been to the hospital, and the hospital itself, the Koster Hospital, was the first to receive the occupational and health and safety certification. So in terms of that certification, the minimum requirements for the facility to be occupied are met. We are not saying that the state is where we want it to be. This is a very old hospital. We agree that some walls are peeling. The roof needs to be completely replaced. But like I'm saying, that has already been planned. And in terms of the consultant that have been appointed, that is those are the areas that are going to be attended to.
So there is no longer an ongoing OHS breach. You're saying that they've been given the certification that they are compliant with the falling ceilings, the leaking roof, the dilapidated electrical wiring. The dangerous situation is compliant in terms of certification.
What I'm saying is that the hospital has received OHS certifications, and I'm agreeing that, however, we are not appreciating that the hospital is very old and it needs to be refurbished. Remember, when you refurbish something, it doesn't mean you have to wait for it to completely collapse. But you need, and the day-to-day maintenance is still happening, regardless of the fact that it's still old. That is why the facility was able to receive the certification.
Okay, I'm hoping that we will speak with the Labour Department and find out how the compliance was met with all these challenges. In terms of deadlines, when is phase 1 taking place as you try and fix the situation?
Yeah, the phase 1 is planned for the 2025-26 financial year, which it is the latter part of this financial year.
So not anytime soon. Okay, very well. Thank you so much for speaking to us this evening. We unfortunately have run out of time and have to leave it right there. Spokesperson for the Northwest Health Department, Tebogo Lekgethwane. You make what you make of that conversation.